Welcome to the Prevent Initiative, a program led by the Aging and Adult Services Agency. Michigan State University is collaborating with the State of Michigan Waiver Program to provide advanced assessment training to program staff. We are excited to have you begin training with us and hope this PowerPoint will help you in preparing for the training sessions. The intention of this presentation is to first discuss what the QualCare scale is and how it was developed, how it is formatted, and what the goal of using it is. We will discuss the format of the trainings that will be completed, and we will discuss how to properly use the scale, score the required items, and how to best interpret these items. First, some background information on the QualCare scale. In 1985, a conceptual model describing the decision-making process used by nurses in assessing and intervening in suspected elder abuse was developed. The model showed that, when making decisions about elder abuse presence, nurses assessed the quality of caregiving rather than the quality of the relationship. It was also shown that there was no concrete deciding variable, and the association between elder abuse diagnosis and the decision to intervene was low. From this work, the QualCare scale was created. It is a 40-item scale used to assess the quality of family caregiving. The QualCare scale was designed for use by visiting home nurses. However, this can be used by multiple disciplines, including social workers. There is no formal protocol or script to follow when using the scale. Instead, the nurse or social worker can complete the scale based on his or her observations following a 1 to 2 hour interaction with the elder and caregiver, such as those which typically occur when providing services to waiver clients. The QualCare scale has the nurse or social worker consider the elder's needs and the extent to which they are met across several domains. As mentioned, when you are completing the scale in the real world, there is no script for you to follow. Most assessment data can be obtained through your standard home intake assessment. Likely, to complete the scale, you will only need to ask a few more choice questions and perhaps take note of a few more elements of the caregiving situation than you previously have been with your intake assessment. It is best not to complete the scale itself in the home with the client present, as you'll be thinking over all aspects of your interaction with the client, their caregiver, and their home. So it is likely best for you to complete it after you leave the client's home, such as in your car or office. On the next slides, we will give you an overview of how to score and complete the QualCare scale. However, first we will discuss the trainings. As mentioned, most of your data will come from your standard intake assessment, something that you're already an expert at. For the purpose of the virtual trainings using Second Life, we ask that you focus primarily on assessing data for the QualCare scale. We ask this in the sake of time and so that you can become familiar with using the QualCare scale and interpreting the assessment criteria. During the virtual training, we will switch between 3 to 4 case scenarios. The trainings will be completed in small groups of 4. Everyone in the group is encouraged to participate in each scenario. However, one person will be asked to take the lead in each scenario in starting the assessment. Patient charts with some background information are included in your training materials to help facilitate the trainings and keep the assessment focused on practicing using the QualCare scale. The scale is a tool that is used to assess elder caregiving and identify potential and actual cases of elder abuse. The scale has 6 different subscales that are to be assessed during a client's home visit. These subscales are environmental, physical, medical maintenance, psychosocial, human rights, and financial. Each subscale has anywhere from 4 to 14 individual items to be rated, and each of these individual item scores are to be averaged for each subscale section. How to interpret the scores is described in the face sheet, which we will discuss later on. Now we will discuss how to score and use the QualCare scale. On this slide is a sample page of the scale. Here you can see each item listed with a description of specific observations that can be made to determine the score for the particular item. When considering whether the client is receiving the best possible or worst possible care, the standard for evaluation is the care that the client should be receiving under optimal conditions. The circumstances surrounding the care and the capabilities of the caregiver are not to be considered in your ratings. Again, only the care that the client should be receiving under optimal conditions should be considered. It can be seen that you can rate each item anywhere between a 1 and a 5. However, we have grayed out rankings 2 through 4, as we very highly encourage you to rate each item as a 1 for best possible care, or a 5 for worst possible care. Use any of the numbers in between only when you absolutely cannot make a concrete determination either way. At the bottom of each subscale section, there's a spot for you to write the subscale mean after you have calculated it. The table to the far right of the page has a column for any notes that you may have and a column for you to note whether an item was not observed. If an item is not observed and cannot be appropriately inferred from your assessment, please do not include it when calculating the mean for a section. In your training materials, you're provided with numerous copies of the scale for your use during the training as well as in the real world. Also included are further printed instructions on how to use the scale and sample questions for the subscales. We understand that the QualCare scale is a large document with many items to include when calculating a client's score. When completing your home visit and assessment, it is impractical for you to have the entire scale and go item by item through it, especially having a home visit assessment to complete. For this reason, we have made a one-page cheat sheet for you to take with you and reference during your home visits. Much of the info required to complete the QualCare scale can be obtained just through your routine intake assessment. However, there are some components that you may not typically look for. This sheet, which is included in your training materials, has the major points that are prevalent in each subscale of the QualCare scale and can be used easily and discreetly for your reference during your visit. Again, it is then suggested that you go through and complete the QualCare scale itself after you leave the home and are in your car or office. Here you see the face sheet, which is included in the QualCare scale. It contains spaces for you to provide client and caregiver information, as well as subscale means and the total average. You are also provided a visual on how to interpret your scale means and whether each subscale is considered excellent, adequate, or poor elder caregiving, as well as suggestions on when to report and when to continue to monitor. At the bottom of the page, you are provided with the number to call to report both suspected and actual abuse in Michigan. Again, the goal of our training is to enable you to be able to identify ongoing elder abuse, as well as potential abuse situations, and help clients in need of intervention. This number is to be called at any of those times. We have now discussed all essential components for you to have a beginning understanding of how to use the QualCare scale and what is to be expected during the virtual training sessions. You have several documents in your trainee packet that can clarify understanding of the scale and the trainings, so please use these as you need them. If you have any questions regarding the content of the scale or the training, please contact the Principal Investigator, Dr. Carolyn Pickering, via the email above. Thank you for watching this video.